हेलो एवरीवन। तो आज हम आपके लिए नई वीडियो सीरीज़ लेके आए हैं, सीक्रेट कोड फॉर नीट पीजी और इनिसेट। इसमें मल्टीपल वीडियोस होंगी सीरीज़ में, जिसमें दिस इज़ फर्स्ट क्लास एंड आई डॉक्टर प्रवीण कुमार will teach you value points, clinchers and high yield questions only. Okay, I will not teach very easy question. I will teach only high yield points which will help you to boost your score in NEET PG or INICET. Okay, so this is the first class and I have created a playlist for it. We will start adding the videos in the playlist as soon as they gets made. So search the playlist on my YouTube channel. ठीक है, तो फर्स्ट इज सीलियक डिजीज़। इसमें हमें क्या कौन सी एंटीबॉडी मिलती है? IgA एंटी TTG। और इसमें हमें मिलता है डर्मेटाइटिस herpetiformis, जिसका ट्रीटमेंट है डेप्सोन। एंड HLA एसोसिएटेड विद सीलियक डिजीजेज HLA DQ2 एंड DQ8। सो आप साथ साथ में एनोटेट कर सकते हैं। टू गेट PDF ऑफ द होल बुक you can purchase the book by filling the Google form link in the description box, और फिर आप उसको टैब पे या फिर उसको खुद प्रिंट आउट निकलवा के उसमें अपने बाय हैंड आप एनोटेट कर सकते हैं। इमेजेस आर नॉट एडिटेड दिस टाइम। ओके, यू रेफर टू वीडियोस फॉर इमेजेस। सेकंड इज नर्व ग्रोथ फैक्टर अल्फा बीटा एंड गामा। अल्फा हैज ट्रिप्सिन लाइक एक्टिविटी, बीटा हैज नर्व ग्रोथ promoting activity and gamma has serine protease activity. Then can you see this image? First image, which is colorful graphics. So this drug is LSD. It comes in the colorful graphics on the blotting paper and flashback phenomena is associated with it. Then an acetyl aspartate peak is seen in Canavan disease and the enzyme deficiency is asparto acylase deficiency. The large posterior fossa cyst. Can you see the second image? There is cyst in the posterior fossa, large cyst. This is Dandy Walker malformation. Then in rapid sequence intubation, we do not do the manual ventilation step before the intubation. Okay. Then is stress urinary incontinence. Drug uses venlafaxine. Okay, drug uses venlafaxine and the procedure which is used to treat is Birch-Colpo suspension. Then is the lysyl oxidase. The cofactor for lysyl oxidase is copper, and this enzyme is inhibited by beta oxalyl aminoalanine, which is implicated in neurolethyrism. Then diphtheria. Alex test for diphtheria is Octor-Looney procedure, which is double diffusion in 2 dimensions. Okay. Then dermatomyositis. So annotate it. Okay. Those who have got the PDF, you annotate on tab, or who have print out, annotate by hand. I will tell many signs. So in dermatomyositis we get perifascicular atrophy. Perifascicular atrophy plus we also get shoal sign. We also get shoal sign on the shoulders and we get V sign on the neck and chest. Okay, and proximal muscles are more involved than the distal muscles. Then is the cancer. In cancer, upregulation of muscle specific ubiquitin ligase is seen. Then is the full house effect. In lupus nephritis, there are deposits of everything: IgA, IgG, IgM, and C3. So this is known as full house effect, and it is found in lupus nephritis. Then is the drug investigation of choice to localize the site of leak in CSF rhinorrhea is HRCT. Okay. Then moderately elevated aminotransferase is given. In question, the clinches are given like moderately elevated aminotransferase, prolonged PT, which is corrected by vitamin K. So the answer is cholestasis. Okay. Because in cholestasis there will be deficiency of vitamin K. Okay. Then clotting factor. Every clotting factor increase in pregnancy except 11 and 13. Factor 11 and 13 decrease during pregnancy. Then is in the spina bifida occulta, AFP is not elevated, whereas in other forms such as meningocele and meningomyelocele, AFP is elevated. Then can you see this first image? Can you see this image? So this is a central non-enhancing scar in the liver. This is focal nodular hyperplasia, and it arises from the Kupffer cells. Then is the second image. Can you see the walled clusters of epithelial cells? This is meningioma. This is meningioma, and what else you find in meningioma? It's semoma bodies. Semoma bodies. Then the factor increasing the risk of gallstones are cholestyramine therapy, ileal resection, high calorie diet, dyslipidemia. Then is the carnitine. Carnitine, it require vitamin C. Okay. Then is the costovertebral and costotransverse joint are a type of synovial joint. Then placental vascular lacunae, if you find in the question, placental lakes are present, then answer is placenta accreta. In placenta accreta, the placenta in adhere to the myometrium. In placenta increta, the placenta invade the myometrium. In placenta percreta, the placenta perforates the myometrium and perforate the serosa and get adhered to the bladder or other organs. Okay, that is placenta percreta. And hysterectomy is the uh, procedure of choice, surgery done, and you annotate it in your PDF. Okay, and to get the PDF, description box, in the description box link is given, fill the Google form. Then is cetirizine. It acts by inverse agonist at H1 receptor. Then lateral superior olivary nucleus function is to detect the direction of sound. Then NMIC is amplified in neuroblastoma, HRAS gene in the bladder, and KRAS in the colon, lung, and pancreatic tumors, CMYC in the Burkitt lymphoma. Then can you see this microfilaria? The nuclei do not extend up to the tail tip. This is the Wuchereria bancrofti. Wuchereria bancrofti. Then nephrogenic systemic fibrosis. It is due to, actually it is a typing error. MRI is, it is due to MRI. It is side effect of the MRI, nephrogenic systemic fibrosis. Then senna laxative, side effect is melanosis coli, blackish pigmentation of the colon. Then if in the question you find ground glass cornea and Salmon patch and ghost vessel, then it's the syphilitic interstitial keratitis. Then urea and Krebs cycles are linked by fumarate, it is asked. Okay. Then if you find in the question shock is there, patient is in shock, hypokalemia and hyponatremia is there, fatigue is there, so adrenal crisis is the answer. Then enlarged styloid process, difficulty swallowing, facial pain and tinnitus. This is the typical presentation of Eagle syndrome. Then Hox B13 gene, it increases the risk of prostate adenocarcinoma. Then Trichomonas vaginalis, it requires the treatment of asymptomatic male partner. Means if the partner is asymptomatic, then also the treatment will be required. Then the Brunner grading of lymphedema. Stage 1 is pitting edema. Stage 2 is edema with the stemmer sign. We can't pinch the skin. We can't pinch the skin. Stage 3 is irreversible skin changes. Then the mechanism of transmission of cryptococcosis is annihilation of the yeast cells from the pigeon droppings. Okay, so it is mixed, or it's not the subject wise which I am teaching, it's mixed content, because in question paper also first question can be of surgery, then second question can be radiology, so mixed questions come, so that's why you get a habit of doing like that. Then stab culture is used to, the culture method used to demonstrate the oxygen requirement of bacterium is stab culture. Then positive lactulose breath test is found in small intestinal bacterial overgrowth. Then VSD, ventricular septal defect, it causes caudal regression syndrome or sacral agenesis. And then rooting reflex, it is fully developed by 34 to 36 weeks of gestation. Then is the neurofibromatosis 1 gene, it is located on chromosome 17, and so 17q11 is the answer. Then barium sulfate, it is contraindicated in esophageal perforation. So whenever there is perforation, the barium sulfate is contraindicated. Then, well, in valproate toxicity, the treatment is L-carnitine. L-carnitine. Then is the major criteria, Duke criteria for the infective endocarditis. So it has major and minor criteria. So major criteria include 2 positive blood culture with typical microorganism, or one single positive blood culture for Coxiella burnetii. It is asked. Single positive blood culture for Coxiella burnetii is major criteria in the Duke's criteria for infective endocarditis. Other major criteria is in endocardial involvement, means new murmur is there, ECG evidence of abscess mass, okay, and these all are minor criteria. This fever is more than 38, vascular phenomena, Janeway lesions. What are Janeway lesions? It are the macules on the palms. Then immunologic phenomena is Osler node and Roth spot. Roth spots are in the fundus and the retina, and Osler nodes are in the on the nodes on the digits. Then all these are minor criteria. Then is the tretinoin. It is a treatment of APML, acute promyelocytic leukemia, AMLM3. Then neurotransmitter involved in mania are serotonin, norepinephrine, and dopamine. Then is the body packing with drugs. So there is smuggler is found on airport with packing the drugs in the body. On X-ray we found it. Then treatment is whole bowel irrigation. Then is the Horrocks apparatus. It is used to calculate the bleaching powder dose or chlorine demand. So the formula for it is N into 2 gram for 455 liter of water. What is N? It is the first cup in which the color changes to blue. When the color changes to blue in the Horrocks apparatus, it means that the chlorine demand is met. Then is the triangle of doom. Can you see this? This is the triangle of doom, and it is bounded medially by the vas deferens, laterally by the gonadal vessels. Apex is the deep inguinal ring. Then is the vials with cytotoxic drug. Do plasma pyrolysis. Okay. So other then is the digoxin toxicity. It is asked several times. The digoxin toxicity is aggravated by hypokalemia, hypercalcemia, hypomagnesemia, and hypernatremia. Hypokalemia and hypomagnesemia, rest is hypercalcemia and hypernatremia. Then this is the NEET PG question previous year. Urethral stricture, do retrograde retrograde urethrogram, RGU. This is the retrograde urethrogram image. Okay, do not confuse with any other image. This is RGU. So it is used for urethral stricture. Then if there is any blunt trauma to the chest, then cardiac tamponade will occur. And annotate the other points. There will be absent wire descent in cardiac tamponade. There will be absent wire descent. Then is the RDA principle. It is not applicable for energy. This is asked. Then is the facial nerve palsy. In facial nerve palsy, orbicularis oculi will be paralyzed. So there will be exposure keratopathy. Then Klansman thrombasthenia. So in Klansman thrombasthenia, there is GP2B3A deficiency, defective GP2B3A. So we differentiate it from other platelet disorder by platelet aggregation test. Okay. Another thing is Bernard-Solier syndrome, in which GP1B9 is defective. Okay. So that is test for Bernard-Solier syndrome is ristocetin aggregation test. Okay. Then I-125 albumin is used to measure the plasma volume, and inulin is for ECF. Evans blue is for again for plasma volume. Then lithium toxicity occurs with thiazide ACE inhibitors, ARBs, indomethacin, doxycycline, and furosemide. Then is the analgesic nephropathy. Treatment is phenacetin, aspirin, and caffeine. Give phenacetin, aspirin, caffeine. Then in the question, clincher are given like tender bony prominence is there, increased pain sensitivity is there. Okay, the answer is fibromyalgia. So these are the clincher by which examiner speaks the answer to you. Answer is fibromyalgia, and the treatment is duloxetine. Then is inverse stretch reflex, which is Golgi tendon reflex. It is a disynaptic reflex. Then adductor pollicis. This muscle is used for neuromuscular monitoring in anesthesia. This is adductor pollicis and supplied by ulnar nerve. Ulnar nerve. Okay. Then is the rugoscopy. FMT question. This is study of rugae of the hard palate. Then what is glomus tumor? It there is sign seen in it, brown sign, which is it pulsates vigorously and then blanches. This is characteristic of glomus tumor. Then the late phase of pollen allergy is mediated by eosinophils. Then is the Dalen-Fook nodules. It is type 4 hypersensitivity reaction seen in sympathetic ophthalmitis, means चोट एक आंख को लगी है, दूसरी आंख खराब हो गई. So it is the sympathizing eye in which Dalen-Fook nodules found, and it is type 4 hypersensitivity reaction. Then there are committees which gave some plans, such as Bohr committee gave 3 million plan, Jungle committee gave integration of health services, Kartar Singh committee is on multi-purpose health workers, Srivastav committee gave village health guide scheme. Another thing that Srivastav committee gave was referral services, and it established the medical education system. Then can you see this image? What is this giant cell? This is Taunton giant cell, है ना? This is seen in xanthoma. Another giant cell is Langham giant cell, in which there will be horseshoe shape arrangement of nuclei. That will be seen in tuberculosis. So this is Taunton giant cell seen in xanthoma. Then in achondroplasia we get macrocephaly. Then haloperidol. It is a classical drug which leads to many reactions such as dystonia, akathisia. So what is akathisia? It is restlessness or urge to move. That is due to the haloperidol, and akathisia treatment is lorazepam and propranolol. Then it causes tardive dyskinesia. Annotate. The tardive dyskinesia is due to dopamine receptor hypersensitivity. So treatment of tardive dyskinesia is valbenazine, VMAT2 inhibitor, valbenazine. Then is the this is akathisia. Then is myotonic dystrophy. Can you see this person? This is hatchet faces. ठीक है, frontal balding is there. Intrinsic muscle of small muscle of hand are affected. This is myotonic dystrophy. CTG repeats are found. Annotate. CTG repeats are found, and Christmas tree cataract is found in myotonic dystrophy. Then is the spill of hydrofluoric acid. We use calcium carbonate gel on the spill. Then retrosternal goiter is best managed by, if examiner is asking what is best management, then it is section through the median sternotomy. Then frozen section is unreliable for determining the microscopic Crohn's disease. Then one disadvantage of laryngeal mask airway is it increases the risk of aspiration of gastric content. It is as laryngeal mask airway. Then the food with high glycemic index and low glycemic index. So the potato, white rice, pumpkin, cornflakes, white bread, these have high glycemic index. Fruits, vegetables, whole grains, brown rice, beans and lentils, they have low glycemic index. Okay, so it is as means high glycemic index means it will increase the all of a sudden the blood glucose level. So that is not given in diabetics. So the food with low glycemic index are to be given in diabetics. Can you see this colonies? These are the molar tooth colonies, okay, in the shape of molar tooth found in actinomyces. So annotate other things. So जो PDF है, अगर if you want to purchase, the description box में link दिया हुआ है Google Form का, उसको fill करिए. ठीक है, WhatsApp पे PDF मिल जाएगी, और annotate करिए उसको अपने टैब में, या फिर प्रिंट आउट निकलवा के अपने हैंड खुद आपको उसको annotate कर सकते हैं आप पेन से. देन मोलार टूथ कॉलोनीज किस में मिलेंगे हमें? एक्टिनोमाइसिस में. देन और क्या मिलेगा इसमें? सल्फर ग्रेन्यूल्स मिलेंगे. एंड इसमें क्या मिलता है हमें? फिलामेंटस होता है, ये फिलामेंटस होता है. एंड इसमें ट्रीटमेंट क्या है? पेनिसिलिन. ये सारी चीज़ें ऐड कर लीजिए. इसके बाद पल्मोनरी एम्बोलिज्म में एक्सुडेटिव प्लूरल इफ्यूजन मिलेगा. देन केशन डिजीज, इट इज़ ड्यू टू द सेलेनियम डेफिशिएंसी, and there is cardiomyopathy which is occurring in this disease. Then Aminoglycosides, they are effective in Pseudomonas but ineffective in Clostridium due to the absence of oxygen dependent channels in the Clostridium. And can you see this image? This is the left medial visceral rotation to expose the kidney and suprarenal vasculature. This is the Matox maneuver, left medial visceral rotation. Okay. Then for varicose vein sclerotherapy, we use hypertonic saline, polydocanol, and sodium tetradecyl sulfate. Then this is, can you see this mustache of the Salvador Dali? This is Salvador Dali sign. This, can you see this ECG? This is Salvador Dali sign seen in digoxin toxicity. It is sagging ST depression. Then is cerebral blood flow is regulated by blood pressure. Then extruded bowel. In gastroschisis, the bowel is not covered by membrane as in the omphalocele. In omphalocele में क्या होगा, जो bowel होती है extruded bowel, it is covered by amnion. But in gastroschisis, extruded bowel जो है वो it is not covered with any membrane, and it gets thickened, edematous and discolored. Then in insulinoma, amyloid deposition is seen. Treatment of insulinoma is diazoxide or octreotide. Medical management. Then cilastatin, it blocks the dihydropeptidase and blocks the renal metabolism of imipenem. That is why it is given with the cilastatin given with the imipenem. Then is the pseudo-isomorphic phenomena. Pseudo-isomorphic phenomena is seen in warts. In warts and molluscum contagiosum, pseudo-isomorphic phenomena is seen. Then paracoccidioides. Can you see this pilot wheel appearance? Pilot wheel appearance. So it is seen in paracoccidioides. It causes South American blastomycosis. Annotate कीजिए. It causes South American blastomycosis. Then other images I will show. Write down here. Okay. अभी यहीं पे लिख लीजिए 3 points और. This is also known as mariner wheel appearance or pilot wheel appearance. Then is figure of 8 appearance. Figure of 8 appearance. Okay, it is seen in the blastomyces dermatitis and it causes North American blastomycosis. Then write the valley fever or desert rheumatism. Valley fever or desert rheumatism caused by coccidioides, and it causes, in it the microscopy we see spherule filled with the endospores. Okay. Then Darling's disease caused by histoplasmosis. तो ये सब एनोटेट कीजिए, है ना, अपनी पीडीएफ में या फिर जो प्रिंट आउट आपने निकलवाया है बुक का, और जिसके पास बुक नहीं है वो डिस्क्रिप्शन बॉक्स में लिंक है गूगल फॉर्म का, उसको फिल करिए, आपको बुक का पीडीएफ मिल जाएगा. Then in the post-styloid compartment of parapharyngeal space is associated with the glossopharyngeal nerve palsy. Then cheese reaction क्या होता है जब माओ इनिबिटर देते हैं, है ना, पेशेंट इज ऑन माओ इनिबिटर एंड ही कंज्यूम्स वाइन चीज़, तो उसमें टायरामीन होता है, उससे बीपी इंक्रीज हो जाएगा. तो आंसर इज फेंटोलामीन. ट्रीटमेंट क्या देंगे? फेंटोलामीन. Then liraglutide is avoided in Mann syndrome as it increases the risk of medullary carcinoma of thyroid. Then Breslow's second life test, to differentiate between the stillborn and live-born fetus, we do Breslow's test. So second life test, stomach and intestine are tested. If the air bubble seen in the stomach, then the infant have respirated. It was live-born. The formula of loading dose, as it is asked in the INICET. So all the questions can be either asked in NEET PG or INICET. So it's not like that you do only INICET PYQs. You have to do NEET PG PYQs also. Many questions get repeated interchangeably. So the loading dose formula is volume of distribution into concentration by bioavailability. F is for bioavailability. And the most commonly test used for testing the pasteurization of the milk is phosphatase test. Then latissimus dorsi is the muscle involved in swimming. Then if the cervical cancer is involving the पैरा आयोटिक लिम्फ नोड देन इट इज स्टेज 3C2। अब एनोटेट कीजिए तीन चीज़ें और। अगर सर्वाइकल कैंसर किडनी को इन्वॉल्व कर रहा है, हाइड्रोनेफ्रोसिस कर रहा है, देन इट इज स्टेज 2B। ओके, इट इज स्टेज it is stage 3B. If the cervical cancer is associated with hydronephrosis, it is causing hydronephrosis, then it is stage 3B. और अगर ये pelvic lymph node involve कर रहा है, then it is stage 3C1. And अगर cervical cancer is involving para-aortic lymph nodes, then it is stage 3C2. Then hemochromatosis associated with chondrocalcinosis and DM, not useful point. Then graft 4, it is ear reconstruction surgery. दिस इज टाइपिंग एरर, तो एनोटेट कर लीजिए और जो भी टाइपिंग एरर है आप उसमें करेक्ट कर लीजिए। ईयर रिकंस्ट्रक्शन सर्जरी के लिए ग्राफ्ट होता है ऑटोलोगस कोस्टल कार्टिलेज। दिस इज लास्ट स्लाइड ऑफ दिस क्लास। इन एसडीएच सबड्यूरल हेमरेज, do open craniotomy if the thickness is more than 1 centimeter and midline shift is less than 5 centimeter, then less than 5 mm, sorry, then do open craniotomy. Then the zinc dose for diarrhea in less than 6 month age, the dose is 10 mg per day for 10 to 14 days. For more than 6 month age, it's 20 mg per day for 10 to 14 days. Then the ions responsible for sour taste are H plus ions. Then if there is stent placement, then postpone the elective hernioplasty for 6 months. Okay. Then this is the first class of secret code for NEET PG video series. There will be multiple videos, okay, more than 80 to 100 videos will be there. So we have created a playlist बनाई है जिसमें आप डायरेक्टली 1 2 3 सारे नंबर वाइज क्लासेस को आप एक्सेस कर सकते हैं हमारे चैनल पे। सो फॉर दैट सब्सक्राइब टू आवर यूट्यूब चैनल, लाइक एंड शेयर दिस वीडियो, एंड आप हमारा टेलीग्राम ग्रुप ज्वाइन कर सकते हैं, उसका लिंक डिस्क्रिप्शन बॉक्स में है। देन आप क्या कर सकते हैं, जो भी बुक का पीडीएफ है, जो ये पूरी बुक जो है जिसमें 100 to 105 ग्रैंड टेस्ट हैं, है ना, उनके वैल्यू पॉइंट्स जो डाले हैं वो अब गूगल फॉर्म का लिंक है, ठीक है। ये बुक का पीडीएफ लेने के लिए गूगल फॉर्म का लिंक है डिस्क्रिप्शन बॉक्स में, उसे फिल कीजिए, ठीक है। और ठीक है, उसको फिल कीजिए गूगल फॉर्म को, और आप इसको अपने टैब पे भी एनोटेट कर सकते हैं साथ के साथ जो मैं पॉइंट्स बोल रहा हूँ, एक्स्ट्रा पॉइंट्स, और आप इसको प्रिंट आउट भी निकलवा सकते हैं बुक को। मोर देन 1200 और 1300 पेजेस आर देयर इन द बुक, जिसमें कि सिर्फ वैल्यू पॉइंट्स हैं, इजी क्वेश्चन नहीं डाले हैं। इजी क्वेश्चन तो कोई भी कर लेता है, और ये मेन नोट से एक ऊपर की चीज़ है, मेन नोट से एक लेवल ऊपर की चीज़ें हैं इसमें, और सारे पीवाईक्यूज हैं, ठीक है। तो आप अगर आपको पीडीएफ चाहिए, गूगल फॉर्म में डिस्क्रिप्शन बॉक्स में लिंक है गूगल फॉर्म का। ओके, थैंक यू फॉर वाचिंग दिस वीडियो। और सारी वीडियोस के लिए प्लेलिस्ट देखिए हमारे चैनल पे, ठीक है। प्लेलिस्ट में आपको सारी वीडियोस मिलेंगी। वी आर स्टार्टेड रिकॉर्डिंग द वीडियोस। ओके, थैंक यू।